Good morning, everyone, and welcome to this event for the Grenfell community about our environmental checks that have been taking place around the Grenfell Tower site. My name is Suzanne Kokonowski. I am a civil servant in the Ministry of Housing and I'm part of the multi-agency partnership that is overseeing and has commissioned the checks. We would have clearly liked to have done today's event face-to-face with you in person, but due to the ongoing social distancing restrictions, we are running today's event as an online Q&A forum. It's an opportunity to meet the scientists who are overseeing and delivering stage 2 of the checks. I will shortly introduce the panel that we've got today, but before that I wanted to set out a bit of background. We will run through some introductory slides and then we should have about 30 minutes for Q&A. If we could turn to the next slide, please. Thank you. So just by way of a bit of background, many of you will know that in October 2018, the government announced that it would deliver a programme of additional environmental checks around the Grenfell Tower site, and this was to investigate potential risk of land contamination as a result of the fire. We completed stage 1 during the summer of 2019 and we published the findings, which are available on gov.uk. These did not show any particular high levels of concern. In fact, most of the chemicals that we found were similar levels to what we would expect in the rest of London. But because some of the levels were elevated, we've decided to do stage 2 of the checks, which is a detailed investigation into those particular chemicals that we found at a higher level. In autumn 2019, we ran a procurement exercise to find a company who would undertake stage 2 of the checks. AECOM were appointed earlier this year, but unfortunately, due to the restrictions of social distancing, we've had to pause the environmental testing. We are hoping to recommence this in August, hence why we are doing today's event. Next slide, please. So feedback from you from stage 1 was that you wanted more opportunities to speak directly to the scientists who are involved in the checks. So today's panel consists of Professor Alan Penn. He is the Chief Scientific Advisor in the Ministry of Housing and his background is building design and architecture. Professor Gideon Henderson, who is the Chief Scientific Advisor in the Department for Environment, and his background is in earth sciences. David Dyson from AECOM, and Dr. Paul Nathaniel, who is an expert in land contamination. He has been appointed separately and independently of AECOM, but his role is as the suitably qualified person to check their work. Next slide, please. So today's event, we will set out the role of the Chief Scientific Advisors, a brief reminder of what we did in stage 1, an introduction and an update on stage 2 of the checks, a brief summary of the role of the SQP, and then, as I say, hopefully we should have about 30 minutes for questions and answers. You can type your questions in using the box on the right-hand side of your screen with the Q&A button, but we will now just run through some background introductory slides, and I will hand over to Alan. Next slide, please.
Hello. So first, just to say thank you very much. I'm really pleased to be here, even though we aren't face to face, and I hope you're all keeping safe in this COVID crisis. So I'm the CSA, that's the Chief Scientific Advisor at the Ministry of Housing, and I started last September. Before that, I was Dean of the Bartlett Faculty of the Built Environment at University College London, UCL, and I'm a professor in architectural and urban computing. And I'm still in that role there at the university as well. So the role of a Chief Scientific Advisor is to bring science to bear on officials and ministers' decisions in the ministry. And so what I do day to day is answer a lot of questions about science. I prepare briefings and I generally try to ensure that the evidence supports the various decisions that ministers are taking. So in a second, I'll introduce Gideon Henderson, who's the CSA at the Department for Agriculture. and Gideon and I are both on board here to give detailed day-to-day scientific advice and oversight on the stage 2 environmental testing. So this is all part of what the Science Advisory Group, which was originally set up and you may well have come in contact with, was organised to do. And they still have an absolutely key role. And so we're working very closely with Sir Patrick Vallance and the other SAG members, Science Advisory Group members, who have a wide range of relevant expertise. Sir Patrick will continue to chair the Scientific Advisory Group, but he's been very keen that as both of us have taken over, that we become involved in the day-to-day scientific advice here. So I'm very proud to be involved in this, and I really see the absolute importance of getting to the bottom of the many questions that are raised by the fire. I understand there could be concern about some parts of the programme having been paused recently, but it's really good now to be getting going again and for progress to be being made. I'm going to pass over now to Professor Gideon Henderson, who is CSA at DEFRA.
Thank you, Alan. Good morning, everyone. It's a very great pleasure to be on this call, and apologies again that we can't meet in person. It's always difficult to talk to an audience without knowing who you are, and I'm sure that you feel the same way. So as Alan has said, I'm the Chief Scientific Advisor at DEFRA, which is the Department for Environment, Food and Rural Affairs. And I've been in that post since October of 2019, so just about 9 months now. I'm also a professor and was previously head of department at the Department of Earth Sciences at the University of Oxford. And I have a particular scientific expertise in chemistry and how it's applied to the planet and our understanding of the chemistry of the Earth. I'm not a specific expert in the chemical agents that are being measured in this study, but my chemical expertise gives me a good general background to the subject that we're talking about today. Just like Alan, as a CSA, I have an independent role. CSAs are brought in for a fixed term to a department as academic experts and leading thinkers, and they are brought in really with a bit of a challenge function to make sure that the science and the evidence that are used by ministers and in their departments is the best possible evidence and is used in the best possible way. So that's the nature of our jobs, and that's the nature of the skills and the role that we bring to this process as well. DEFRA's had a particular role in the Grenfell environmental aspects. In general, DEFRA has a role in managing the environment. It's in our name, DEFRA Department of Environment. So, for instance, it's our responsibility to monitor and assess air and water cleanliness routinely. And it's also in DEFRA's responsibility to look after the environment after an emergency. So that's why we're involved in this call. And the Environment Agency, which is a part of the DEFRA group, has been part of the multi-agency group of those advising the commissioning of the chemical assessments that we're talking about today. We are, all of the group, and certainly I'm personally committed to a very detailed investigation so we can really find the answers for the community that are needed here. And the results of these chemical environmental tests will be used to assess public health and to assess the actions that are needed as a consequence. We welcome community engagement. This is part of that process, and we look forward to further involvement. Obviously, that will need to be need to take account of the safety issues because of the unfortunate COVID outbreak. And that's also true to when it comes to meeting with residents. I very much look forward to meeting with residents and visiting the site, and unfortunately not able to do that now, but I hope that will happen soon in a safe way. Alan and I will both be very happy to take questions later on this question and answer session after the rest of the presentation. I look forward to that. Thank you. And now I'm going to pass over to David Dyson, who's at ARCOM and leading the work in the field.
Thanks, Gideon. Hello, everyone. Good morning. I may be a familiar face to some of you if I met you during stage 1 of the environmental checks. On this slide, you can see me with some of the rest of the ACOM team during the stage 1 sampling. I'm pleased to be here today to continue this work that we started at stage 1 and to have the opportunity to talk to you about stage 2. Stage 2 is all about further soil sampling leading to the detailed health risk assessment, so we can try to provide you with the answers that you've been looking for. In addition to the sampling that we'll do for stage 2, we're also keen to look at opportunities to work with the community on initiatives such as talks in schools. But just before I go through what to expect at stage 2, I'll give you a quick update and reminder of what we did and what we found at stage 1. Next slide, please. Okay, this slide is only partially appearing, so it's just appearing there in full now. Okay, that's come through. So just as a quick reminder, at stage 1, initially we gathered information on chemicals from the Met Office, from residents, at community engagement events. We collected samples from 21 locations, generally at 0 to 5 centimetres depth, but in one area slightly deeper as well, at 10 to 15 centimetres. We looked at the levels of the chemicals in those samples, plus how you could be exposed, plus who or what might be exposed, and integrating those 3 things gave us a risk. In terms of what we found, generally, the assessment showed that the levels of the chemicals were below screening levels or below what is generally found in London. So on that basis, the health advice from Public Health England stayed the same as before the stage 1. We didn't find evidence of increased risk to health, but we will continue to investigate the potential for land contamination during stage 2. Next slide, please. Okay, so what will we be looking to do at stage 2? There's a timeline here on screen you can see, and this will involve further sampling and health risk assessment to provide final conclusions and recommendations. The initial design for stage 2 sampling was developed by us from the findings of stage 1, and it was published on the government webpage as Technical Note 18. As part of the stage 2 sampling, the main chemicals we will look at are lead and PAHs. These exceeded our screening levels in some areas, but in addition, we'll also be looking at asbestos and a group of chemicals called dioxins and furans. So some key milestones on this stage 2 programme of work. The site walkovers, you can see there, August, the approximate dates for that. This will seek to establish the locations that are suitable for testing, and I'll come on to these proposed locations shortly. But it will involve us looking around the areas to identify specific points to take samples and discussing these with residents and schools. If a location isn't suitable, we may have to identify an alternative nearby. The plans for doing the site walkovers are currently progressing, and we're hoping that these will take place in mid-August. So after the walkovers, there'll be a detailed final design of the sampling plan. And this we would expect to be similar to the stage 1, the design that was put together at the end of stage 1, but there may be some changes based on the site walkovers and other new information. A community event will be held to share the details of that design before the sampling is carried out. The sampling, we would expect it to be between September and November time to be confirmed, but like at stage 1, there'll be opportunities to observe the sampling. The samples go off to the laboratory where they can take 2 to 3 weeks to be tested. And then after that, we would expect it to take a few months to analyse the data and produce the final report, which will include the risk assessment, the results and recommendations. And this report will be shared with you once it's complete. Next slide, please. So the locations identified for sampling at this stage for stage 2, you can see marked on the map here. The focus is on locations including schools and community kitchen gardens, the majority of them being 1 kilometre from within 1 kilometre of the tower in the northwesterly direction, in line with the smoke plume. but samples will also be taken in other directions around the tower up to 500 metres away. The schools and nurseries and colleges where we propose to test were identified from requests for testing and concerns about impacts which were raised at community events during stage 1, as well as the council's list of schools. There are 34 locations proposed here, 2 of which are in Hammersmith and Fulham, 1 in Brent, the remainder in Kensington and Chelsea. Thanks for listening. That's the end of my section. I'm going to pass you over to the independent SQP, Dr. Paul Nathaniel.
Thanks very much indeed, David. Just waiting for the slide to change. My name is Paul Nathaniel. Again, I will have met some of you during the site works and the walkovers and the various workshops. My role is to look over the work that ACOM are doing, make sure that it's being done in a way that is consistent with good practice, the relevant standards and so on, and specifics of signing the Suitably Qualified Persons Declaration involves answering 5 questions. My declaration basically says that I'm satisfied that the work's been carried out by people who are appropriately skilled and capable, that the work's been done with reasonable skill and care, and the information and data are appropriate, there is the right scope and objectives, that the work's been done in accordance with relevant good practice, guidance and standards, that the work's based on robust science and is factually correct, that it's been appropriately reviewed within ACOM, and that there are a variety of specialist areas of knowledge, and that each of those aspects have been covered by an appropriately qualified person with skills and experience in that specialist area. That the interpretation and conclusions are reasonable, and that any proposals to mitigate actual or potential residual risks are appropriate. And I signed one of these declarations at the end of stage 1, so if you want to see that, it's on the MHCLG website. One other thing, this is a complex area, and if you have any questions about the science or the legislation, then do feel free to get in touch and fire emails through MHCLG, and I will try and do my best to handle them. Or if we finally meet on site or at a workshop, then again, do feel free to come and talk to me. And now back to Susanna for your Q&A.
Great, thank you, Paul, and the rest of our panel. So that concludes our introductory slides. As I said before, if you've got a question, please do type it in using the Q&A button, which should be on the right-hand side of your screen. We will publish answers to all the questions asked today. So if we run out of time and we don't get through to your question, we will publish an answer in one of the Grenfell community updates and circulate those to you. So we've had one question come in by email in advance, which I will turn to first, and then we will start answering the questions that have come in. So the first question that we've had through by email asks that studies from other areas would normally find persistent organic pollutants from flame retardants. Why were these not found in stage 1? And are you intending to review the results of stage 1 as a result of that? So David, can I turn to you to answer this, please?
Thanks, Suzanne. The testing that we did for flame retardant chemicals, we tested for them in all of the samples. We didn't find them, generally speaking, above the testing limits, and the testing limits are based on health risk assessment. So we have results which we have been through a industry standard good practice to achieve. We have results which say that we did not find those chemicals at concentrations that we would consider to be a health risk.
Thank you, David. I hope that answers the question there. So I'll turn to our next question, which has come through. So this refers to evidence which was submitted to the Grenfell inquiry, which finds that hydrogen cyanide levels in the fire were very high and stemmed primarily from burning upholstered furniture containing flame retardants. Why has the Grenfell Science Advisory Group therefore decided there is insufficient evidence to provide a sound scientific basis for the need for testing of the indoor environment? And do we need to look more closely at the role of flame retardants? So I think David has partly touched on flame retardants already, but I will take this question about indoor testing because this has been asked a number of times. We've looked really closely at whether we should do this, both in the multi-agency partnership and also taking the advice of the scientists on the Science Advisory Group. What we are trying to do through the testing is we've had air quality monitoring since the weeks after the fire, which looked at chemicals. And then the concern was that any chemicals that were in the air might have fallen down and therefore can cause land contamination, which people that might therefore be touching or might have contaminated fruit and vegetables in the area. So the purpose of the checks has been, even though we didn't find anything of concern in the air quality, to check that nothing that went in the air essentially came into the soil and might have caused a concern. The challenge with any chemicals that might have been blown into people's homes, again, I just repeat that we didn't find anything through the air quality monitoring to be concerned about. But if those chemicals went into people's homes, the challenge is that A, they might not be there at the current date. The advice and the best public health advice was for people to clean the dust and dirt out of their homes, and that remains absolutely the best advice to get rid of anything that might have blown in through windows. And secondly, the challenge with any dust inside homes is that it's really difficult to pinpoint that as a result of the fire, as opposed to any chemicals that might be in the home in an everyday scenario. And what we are looking at through the testing that we are doing is establishing what's called a contaminant linkage between the fire and the contamination. We found evidence of contamination from potentially different sources in the soil, but those may well have been there for years and in fact hundreds of years in some instances, and are part of normal everyday background levels that we would expect to see, particularly in cities and London. So the challenge which the Science Advisory Group agreed with us on is that if you are to do indoor testing, you cannot necessarily link that to the fire, and the testing and the results of that might find results for any number of reasons that would be skewed. So what we are trying to do through this testing is establish that if anything went up into the air and then has contaminated the land and the general area as a result of the fire, we would expect to see higher levels and higher concentrations closer to the tower than we would expect to see in other areas. And that is the aim of our work to date. So I hope that answers the question. I've got another question about the procurement of AECOM. Was this contract tendered and in keeping with government guidelines? This is another one that I can take. So yes, we have followed government best practice on procurement. What we did for stage one was what's called a direct award, and because we wanted to get stage one, which was the background stage, underway really quickly, we looked at the government framework of companies who were able, willing and suitable to do this work. And there are a number of companies on government frameworks. They cover all sorts of different areas of expertise, and these are companies that are willing to bid for government work and have had their due diligence checks and financial checks completed in advance. So this is the best way for government to be able to procure companies. Otherwise, we would do what's called an open award, where we publish an advert and any company can reply. That tends to be companies who may not have done work for government before, and maybe smaller, and or have had less financial checks carried out on them. So that takes longer to carry out those checks, even if that they are successful. That is what we did for stage 1. For stage 2, we decided to not do a direct award because we appreciate that that doesn't have the competition involved in it. So we did a full procurement, but we did that using the companies on the government framework. ACOM came through a fair and open competition. We believe that they've got the best experience in the country, having done numerous of these land contamination exercises in lots of different parts of the country. We had 10 responses from different companies, but in going through the process, some companies dropped out. And then, as I say, through fair competition, we selected ACOM as the company with the best experience and the best ability to do this work. Turning to our next question. For the first 10 days of the fire, there was no local air tests. People breathed in dust and dirt, including asbestos, furniture, and from dead bodies, and that was washed away by the rain and the water from the fire brigade. The tests are showing no difference from the rest of the area, but Professor Steck immediately tested the soil, and her tests showed that there had been contamination in the soil. So for all those who breathed in polluted air, should the testing be carried out regularly over the long term? I'm quite keen to turn to someone else on the panel. So I might turn to Paul, if that's okay, and then I can come back in relation to the future testing. But Paul, if you're able to sort of set out what we've done through the regulations, and if there will be a need for further testing as a result of that.
Okay, thanks, Suzanne. The particular legislation we're looking at, Part 2A of the Environmental Protection Act, is a risk-based approach, and it applies in sequence to consider the land uses and what's happened on land, and then progressively focus in on those chemicals that might be posing a risk to human health. And that's exactly what's happened in stage 1. The stage 1 involved testing a large number of chemicals, and as David said earlier on, the attention now focuses on those chemicals where generic screening levels were exceeded to allow us to go further in the detailed risk assessment. Suzanne, I could keep going, but I think I'll probably stop there just in case.
No, thank you, Paul. I think you've answered that. Thank you. We've got some questions which are about how to contact us, so I think we will just confirm the details at the end and make sure you can speak to us individually and direct about any additional points. So I'll turn to our next question. Given we've already expressed our concerns about the appointments, I think this means about the appointment of ACOM, and requested that they do not proceed in the same manner. Can I ask what has changed? So I know there's been some concerns about the procurement and the procurement of ACOM. These have been discussed with individuals and with groups. As I said earlier, we are following government best practice in terms of procurement. And I know there are ongoing conversations about the community being able to select someone of additional independence who would be able to join and oversee the checks. We're absolutely happy with that. We feel that we've got a number of layers of independence built into the process, both through the Chief Scientific Advisors, the Science Advisory Group, Dr. Paul Nathaniel, who is independent of ACOM, and absolutely they are scrutinising the work of ACOM, ensuring that they are compliant with all the regulations and the guidance, and we are publishing lots of information about what we're doing, why we're doing it, and all the findings. So the core data and all the information will be out there. We are holding events like this, so anyone with any additional expertise or challenge to what we're doing is able to answer those questions. But what we do need to do is to get to the bottom and reach, conclusive evidence of whether there has been land contamination as a result of the fire. And that's what we are doing through the checks that we are carrying out.
Suzanne, maybe I could come in on that question.
Thank you.
Well. This is Gideon. From my involvement, I just want to express my view on this from my involvement relatively recently with this process, which is that the SAG has been scrutinising the work of AECOM and assessing what was done in the first phase of the chemical measurements. So it has been looked at by that independent group, including by Sir Patrick Vallance, who remains engaged. And indeed, both Alan and I met with SAG members and scrutinised the findings of the full Stage 1 report in detail and have been content with the findings in that report. We continue to be very closely engaged as independent scientists in this process. So there is a level of scrutiny on AECOM's work through that process. And as has been said just now, there's also a great willingness for us to engage with the community. And if there are questions where you are concerned about the accuracy or the care with which AECOM are working, we'd be happy to hear them and to consider them in detail. Thank you.
Thank you, Gideon. So turning to our next question, David, if I could come to you on this one. We've got a question about accompanying the scientists when they do the testing, and when will this be?
Yes, so the testing, well, the site walkovers we're hoping will be mid-August. I know there'll be opportunities to accompany the walkovers. The plans are still being drawn up as to how we make sure that that's secure and safe from a COVID perspective, but there will be ways to get involved, and that will also be the case for the sampling. So the idea being that obviously in areas where in public areas where we can have members of the community watching the sampling, similar to Stage 1, but again, obviously taking care that we're being safe from a COVID perspective. So yes, I mean there will be opportunities to join, but it's just making sure we get the procedure right for COVID security. And so sorry, just the timing for the sampling itself, we would expect to be September onwards, so mid-September maybe will be around the time we would expect sampling to start, and could be for a period of a month or more. Thanks.
Thank you, David. So I think we are looking at small groups to accompany the site walkover. As David says, we need to comply with the social distancing restrictions, and we will be in touch with resident associations and other community groups in relation to seeking nominations for that. Turning to our next question, David, I think this is another one for you. In relation to the Stage 1 results, I'm wondering why you didn't, and/or if there's a need to do soil checks in Holland Park. Some of it is within a mile of Grenfell Tower and where children play. I'd understood that the radius of the checks would be a mile. It's now only 500 metres.
Yes, okay. So at Stage 1, the radius was up to 1 kilometre, but it was very much, we did then base it on the plume direction, the direction that the smoke travelled, and also feedback from residents in terms of where debris was found, and that was very much strong weighting of debris going to the northwest of the tower. We did collect samples from 400 or 500 meters at least distance from the tower in all other directions, so to the southeast as well, which will be more towards the direction of Holland Park. But the findings from stage 1 didn't suggest that we needed to then expand the testing in that direction, which is pretty much the opposite direction that the smoke and the debris principally travelled at the time of the fire. So that's why we haven't extended that far away to the southeast into Holland Park.
Thank you, David. Our next question is, why have we not been allowed to join remit or technical meetings? How will you gain our trust? So I think this might be referring to access to meetings of the multi-agency partnership and the science advisory group. And we felt that the agencies and the scientists needed a bit of space for them to look at the information and come to their considered views as well, and then for us to be able to communicate that to you. We have published minutes of those meetings, so you can see what is discussed and when. And those are the only really meetings that are taking place. What is happening is, through each of the stages that you're aware of, the site walkover and the testing that AECOM do, they carry out the checks and they are then getting the lab results and writing up their findings, and then we are publishing all of that in full. There are no other technical meetings taking place behind closed doors. We've invited the community to attend and observe the procurement, which would lead to the appointment of AECOM, and we've invited the community to attend and observe the site walkover, conversations about the design and where the testing location should be. And we're having regular events like this where you can absolutely ask the questions and meet the scientists, and we can deliberate some of the questions like indoor testing that come up. If you've got any further suggestions, we are always happy to hear them, but there are not, lots of meetings between us and AECOM, for example, about the findings. The work comes back from the lab, and then that is what we are publishing. David, if I can turn to you for the next question, when will we be given the results of the tests taken inside the tower?
There hasn't testing from inside the tower structure. We're not involved in any testing inside the tower structure. We did some soil sampling from within the tower cordon at stage 1, and that was in the results of stage 1. That was those soil sample results within the tower cordon were in the stage 1 report. But we have not done any testing from inside the tower itself.
Thank you, David. So if I could just confirm on that. So the inquiry has done testing from within the tower, which it will consider through the assessors that it's got, and it will feed through into the inquiry's conclusions. And I know that they have looked at some chemicals, but as a result of the fire and for a slightly different reason. As I said earlier, what we've been looking at is anything that may have gone into the air and therefore has fallen into the soil as a result of that. So all our testing has been from soil or the soil that's in containers in the local area. So as David said, we looked at the soil within the cordon, which is around the Grenfell Tower site, and that is all contained in stage 1 of the testing report. David, if I can turn to you on the next one, but then we might want to take any comments from perhaps Gideon, I think. So this is about, if I could, can you come back to me to answer the question, ask the question? Thank you. So this is a question about food, growing food. Many schools in the area grow food as well as individuals. Which chemicals have been found that are over normal levels? I've been eating homegrown food for 3 years. Did that give me the cancer that I am recovering from?
So in terms of the chemicals that are above normal levels, I think it's important to say at this stage that there's a really wide range of concentrations of certain chemicals that you find in urban soils, just because of the large differences in historic land uses. So normal is a difficult thing to define. It's not a precise number. So generally speaking, we didn't find any chemicals consistently above normal levels. I think that's important to say. There may have been 1 or 2 samples where an individual result was higher than an average background, but then it would typically be part of the average. So we haven't found anything that's obviously above normal levels. The chemicals are just, but to refer to the specific chemicals, lead and polycyclic aromatic hydrocarbons as a group of compounds, they're the 2 main groups of compounds that we'll be looking at stage 2, precisely because there were 1 or 2 results which were slightly higher than some measures of background or normal levels that we have. So they're the 2, let's say, lead, polycyclic aromatic hydrocarbons, that we'll be looking at in most detail at stage 2. In terms of the homegrown produce, that's something that we'll be looking at in more detail at stage 2 as well, more sampling in community kitchen gardens, allotments, those kind of places. The final part of the question is not something that I can answer directly from our, from what we've done.
So I can come in on this question as well. This is Gideon speaking again from DEFRA, and I support what has just been said. The key findings from stage 1 made it clear that the two chemicals that were above screening level most commonly were lead and the polycyclic aromatic hydrocarbons, the PAHs. These were not generally above the levels found elsewhere in London, however, although they were above values you might find in completely different settings, far away from any possible contamination. So in general, the risk of growing vegetables in this area is equivalent to the risk of growing vegetables elsewhere in London in broad terms. It is typically true that growing material in soils tends to filter out a number of chemicals through the growth process. So there is also the possibility that the vegetables will be cleaner than the soil. But the fact that the soil has levels of contamination that are effectively equivalent to elsewhere in London means that we wouldn't anticipate there being a particular risk from growing in this area. I definitely would support, though, the idea that areas where vegetables are grown are a particular focus of measurements during the stage 2 sampling to make sure that the specific areas, the soil is checked in those settings as well. And I suppose from a public health point of view, it's worth reiterating the guidance that is made for many public health issues, that it's always worth washing vegetables thoroughly or cooking them where appropriate to make sure that you remove contaminants. And that's true for COVID, of course, as well as the surface contaminants that might come from the environment around Grenfell. Thank you.
Thank you. And just to say, if anyone has any concerns specifically about their health, please do do talk to your doctor so that they can ensure that you've got access to the right treatment that you might need. Turning to our next question, Paul, I'll turn to you on this one if it's okay. What about testing of burnt contents from inside the tower, which would have been the main source of HCN?
In the particular question that stage 2 is trying to answer, it's what is in the soil in the surrounding area that we're trying to establish. The chemistry is well reviewed. So going inside the tower isn't going to add information to the risk assessment that AECOM are having to do. It's what's in the ground that people might be exposed to if it's there. That's the basis on which the testing and the sampling is being carried out.
Yeah, and just to add to that because we are looking at the potential sort of health consequences of anything from land contamination, that is the route that we are doing it through, as opposed to it's the link between the sort of health consequences and the chemicals that we find, which is what we are looking at. Paul, a follow-up to the question about indoor testing, with a specific request that you might like to add any additional comments. So in relation to indoor testing, a comment that surely it's not just measuring dust, and that it's obvious what might be in people's homes as a result of the fire and what is not, particularly given that Professor Anna Steck looked at particular particles, albeit I think she was testing again in the soil, and a concern about dust within people's homes as a result of the fire.
So the question, it's a question I've been asked before on this. Again, what we need to look at is what is in the soil, and then the exposure assessments that AECOM will do looks for the dust being tracked back indoors, and that will be taken on board in the exposure assessment. Going and doing indoor testing doesn't necessarily inform that risk assessment as to what is coming from the soil.
Thank you. And Paul, another one for you, I think, but perhaps Gideon and Alan might like to come in on this one as well. So this is a comment that waste incinerators need special filters to remove dioxins from burning sofas and mattresses which contain flame retardants, which then need to be safely disposed of. Are you saying that Grenfell Tower proves these filters are unnecessary?
The short answer is no. When you're incinerating waste, what you want to make sure is that any emissions to atmosphere are safe, and that's the purpose of those. There's a number of controls, of which filters is one. They need to carry on. It's so no.
Gideon, I don't know if you want to come in. Thank you.
Well, I can come in as well. I think it's important here to differentiate what happened at the time of the fire and in the tower from what we are doing now with this environmental testing. It's very probable that there were contaminants in the air in the fire during the time of the fire, particularly inside, and that is being looked at by the inquiry and has been written about before. The issue that's of particular relevance to the environmental testing is whether those contaminants have got out into the wider environment and are impacting people's health now and in an ongoing sense. And the two ways that that will impact on people in the community is if those contaminants are to be found in the air at this stage, or if they are to be found in the soil, which could then be remobilized and brought back into the air or incorporated into plants or otherwise ingested. So the important thing from an environmental point of view at this stage is that the air quality is checked and that the soil quality is measured. And that's the goal of the ongoing air quality measurements and the stage 2 report that is about to be sampled for. So it's probably important to recognise that we cannot go back and resample inside the tower at the time of the fire, and that's the nearest equivalent to what happens in an incinerator where you do fit filters today. Thank you.
Suzanne, can I come in on this?
Yeah.
It's Alan Penn. So just one other point about this is that the reason you have filters in waste incinerators is because they operate continuously. And so for anybody living downwind of a waste incineration plant, it's not just a one-off event. It would be a continuous event as safers are burned all the time in the incineration plant. And so filters are absolutely necessary in those situations because people would be getting daily exposure to the content of burnt stuff. The fact that we don't find elevated levels, or in the stage 1 we have so far not found worryingly elevated levels of these contaminants in the soil surrounding the tower, is not a proof that you don't need to test for incineration plants and you don't need filtration for those sorts of plants, which are continuous operations.
Thank you, Alan. So we've got about 5 minutes left. I know there's still questions coming in. If you do want to submit a question before we close, just a reminder to use the Q&A button on the right-hand side, and we will respond in writing to any that we don't reach. So a question about testing for people as a result of anything that they may have breathed in directly as a result of the fire. So I appreciate that people are concerned as a result of what they may have breathed in. The NHS has introduced some tests and some checks for people, and there are, particularly for any respiratory concerns, there are services that people can be referred to via their GP. And that's obviously if people are showing symptoms or they've got any concerns, as I say, particularly respiratory concerns as a result of anything that they may have breathed in. And then additionally, what the NHS and the public health team in the council are doing is looking at the data for all of the area to see if there are any trends. So any information coming out through GPs. There have been surveys of the population to see if there's any evidence of any trends in the area as a result of any contamination of the fire. So as well as what we are doing to establish if there are any direct linkages between the fire and contamination in the soil, there are other ways of monitoring the health of the population. We have had questions previously about biomonitoring, which are blood tests potentially for populations who have been affected by any contamination. And our view, which the Science Advisory Group have also looked at, is there isn't a specific test that we could do. You need to have a specific chemical that you're testing for, and so that isn't the right way in this instance to look at the population of the health population of the local area. And so that is what is being carried out through looking at information and longer term public health monitoring of trends in the area. Alan, this might be one that you can help with, or it might be that this is more for the police and the inquiry. Do you agree that the majority of the toxic fumes which led to 72 people losing their lives came from burning internal materials such as furniture and not from the cladding?
Oh dear. I mean, this is actually a question for the coroner's court. I must say that the cladding burning will have produced horrifically toxic substances. The internal furnishings, when they caught fire in anybody's flat, will have created horrifically toxic substances. The heat and the lack of oxygen actually will have killed people. It is really hard to say what the actual cause of death was, and the coroner will do their best, but I suspect that the answers to this will never, you'll never know in any individual's case what it was. I think that there's an underlying element here, which is a question around the use of fire retardants in furnishings. Fire retardants in furnishings are particularly toxic chemicals in their own right, but they have a role which is to try and stop fires from happening in the first place. So the cigarette on the sofa smoulders and goes out rather than causing a fire which then consumes the whole premises. In the situation you had in Grenfell, where the fire apparently moved up the outside of the building through the cladding, is a different kind of situation entirely, and I think is one where any of those flats was bound to catch fire, and any sofa inside it was going to catch fire, whatever retardants it had in it. The fire retardants are fantastically successful actually in reducing household fires in general, so they're a good thing in that sense. However, they are very toxic substances in their own right, and when you do have a fire that consumes them, they do contaminate things. So I think that's as much as I can really say about it.
Yeah. Thank you, Ellen. I'll just take one final question and then I will wrap up, including giving you our contact details. So David, I think this one is for you. Professor Steck's preliminary results shows that there needs to be a wider testing circumference. Why is this not being considered through our testing locations?
Thanks, Suzanne. The testing locations that we proposed for stage 2 are based on our findings from stage 1. The evidence that we've gathered really suggests that to the northwest of the tower it is the key area. We have gone further than stage 1 testing. We have extended out to Little Wormwood Scrubs is one location which is now further away than the stage 1 1 kilometre circumference we used, and in fact we're also looking at a site up in Brent which is a few kilometres away, and that is precisely for the reason to assess if there could be impact at those greater distances. So, but what we've really found in stage 1 is that there is not a justification to extend beyond other than in that northwesterly direction, which we have extended for some locations. So really we're keeping the focus within that kilometre radius of the tower.
Thank you, David. If I could just turn to the final slide. Thank you so much for your questions. I appreciate doing this online through a Q&A means that some of the follow-up might be a little more stilted than you would get if this was face-to-face. But as I said at the outset, we will publish written responses to all the questions that we've had today, including those that we haven't had time to reach. And if people are not satisfied with those answers, or indeed want to have follow-up questions with us, we are more than happy to do that individually over the phone. If there's demand, I'm sure we would be happy to do this session again to give you as much opportunity to hear from the scientists involved as we can. So just to recap, you'll be able to watch this, or for anyone who's missed today's session, on our YouTube channel. We will publish the answers, as I say, and we will talk to local community groups and resident associations to seek nominations for the site walkovers. If you've got any further questions or you want to get in contact with us, our email address and phone number are on the screen: environmental-checks@communities.gov.uk. And if you've got any questions about your health or you're showing any symptoms that are concerning you, please do talk to your GP and access the NHS services that are available. And we will publish the answers in our community update, and we will ensure that anyone who's got in touch with us has an opportunity to see all those answers written down. Thank you very much for joining us today, and we will be in touch. Thank you.